Before diving into the topic, I just want to give you one clarity that many people will be having a confusion like, is PCOD and ovarian cancer the same? So, first, let me tell you the difference of this. PCOD is something which is related to hormonal imbalance, and there is a multiple cyst formation in the ovaries. So that is the meaning called polycystic ovarian disease or syndrome. So there are multiple cyst formation in the ovaries. And next, coming to the ovarian cancer, it is naturally occurred in the people who is older, the women older than 40 and 50. So ovarian cancer is seen in them. The ovarian cancer is the disease which the formation of tumor happens. The carcinogenic items as agents are activated in the ovaries.
Cervical cancer is a type of cancer that affects the cervix, the lower part of the uterus connecting to the vagina. It is most commonly found in women between the ages of 30 and 50. Cervical cancer is the second most common cause of death from cancer in women. The most commonly used techniques for cervical cancer screening are the Papa-Nicolau test, also called Pap smear, and the HPV test. The Pap test involves collecting cells from the cervix and examining them under a microscope to look for any abnormalities. The HPV test detects the presence of high-risk types of human papillomavirus, HPV, that are associated with cervical cancer.
Today's topic is ovarian cancer. So this topic is not too much vast. Last video I have explained liver cancer, very much similar to liver cancer. You know the basic idea, what is cancer, what is tumor, what is benign cancer, benign tumors and malignant tumors. So today we are gonna discuss about the second or third part of the cancer. So initially I have done with the breast cancer, and second one was the liver cancer, and now it is with the ovarian cancer. So what is ovarian cancer? Ovarian cancer is a malignant tumor. In the case of liver, I just told you it is a benign tumor, but in ovarian cancer, it is a malignant tumor which forms in the ovaries, lining of the ovaries, lining of the fallopian tube, and it is formed in the abdomen also, because when the cancer is spread throughout the uterus, once it starts in the ovaries, of course it is spreading to the fallopian tube, later uterus, fundus, and then finally to the abdomen part, where your blood circulations also have the cancerous cells which can spread to bones and lymphatic systems. Many more complicated cases are there, very complicated. So basically, if I want to discuss, ovarian cancer is the fifth most common cancer in the women and top second most common cancer in United States. So as per the record, it is the topmost second cancer in the US. To tell you the truth of the ovarian cancer, for 70 to 80% of the women, the symptoms are not seen. There is no symptom. In the zero symptom, the cancer would have been developed to the stage of third and fourth, and there is no single symptom for that particular person. So in this case, after, I literally recommend a woman in the age of 30, 40, 50, after 30, I think a woman should be regularly matlab yearly once at least meet your gynecologist. Just see your health condition, whether it is good, any precautions should be taken. It is not that you're just going for your hospital when you're sick or when something is out of your hand. You should take some precaution measure. Okay, you will get to know how is your body, because body will signal the human at every single minute. At every single minute, the body is gonna signal you what is your health condition. There are many things, and I'm gonna make a video, next video, at what condition, how the body is gonna signal for you. So that is my next topic for sure. I'll make it. So when you feel that you are perfect, you're all right, but still if you're feeling some uneasiness, there is a chance of you can go and meet a doctor. But when you feel you're perfect, everything is fine, good, okay, but at least once in a year you should have a regular checkup, which is very much precautious for your health. So this is the condition where ovarian cancer won't let you to know the symptoms. So coming to the survival chances. First, I will discuss about the survival chances. According to the year-wise, I'm gonna give you the data. From last 1 year, 70% of the women are saved. From last 5 years, 45%. And from last 10 years, it is just 35% of the women are saved. So this is the survival chance if a person is facing with ovarian cancer. At what all tissue you will see the attack of cancer initially? The tissues which are prone for the ovarian cancer, like the epithelium tissue present in the ovary, surrounded, the germ cells, and the stromal cells, the stromal tissues. So these are the primary tissues or the site for the attack of ovarian cancer. Diving into the symptoms of the ovarian cancer. So what are the major symptoms? The female will face with blotting, abnormal urinary bleeding, uterine bleeding. I'm very sorry. So if you are thinking that it is your menstrual phase, sometimes you may feel that all of a sudden you will get bleeded. So you have to go and meet for the gynecologist at any cost. So next symptom is abdominal pain and urinary symptoms like urinary tract infections, high acidic of urine, and there will be depletion of the mucus layer in the urinary tract. All these things are there, and rare cases and the highest final cases, gastrointestinal symptoms are also there. So these are the major symptoms of the ovarian cancer. So if I want to repeat, it is blotting, abnormal uterine bleeding, urinary symptoms, and in rare case, gastrointestinal symptoms. How can you prevent ovarian cancer? Ovarian cancer can be prevented through surgical, through chemical, and you have to be more precautious. So testings will be happen, genetic tests will be happening. So you can prevent it by knowing before only. So you're prone to this. You can prevent it by that, by managing your health. And surgical, if I want to tell, they will cut off and remove the ovaries. So it will prevent the further spreading of the cancerous cells for the another tissues or anything. Since it is a malignant tumor, so it has to be taken more precautions. And chemically, by taking birth control pills, these are the chemical preventions of ovarian cancer. I'm ending the video with all of my talks. So thank you so much for your support. I'll meet you in the next video.